Hi everyone, my name's Val. I am a nursing student and I wanted to kind of start off this channel in hopes that this can help somebody the way that the advice of people that I know that have been through nursing school has helped me. So I kind of wanted to give a little, a few pieces of advice here and there about what I found was really important for me during my nursing school adventure and what I think maybe in hopes it will help you guys out there. I know there's a lot of people in the cohorts that are coming up asking a lot of questions on the nursing Facebook page about like what they should do to prepare or any advice. And I think in the beginning it's really hard because there's a lot of people telling you, what you should do and what you should get and where to focus, and it's kind of a lot of information and you're on information overload. So this is just kind of like my best advice on that, and hopefully it can help somebody out. And I think I'm going to do a video a little bit later about things that I had purchased that I found useful for nursing school. But yeah, let's get started. So as I said, my name's Val. I'm a current nursing student here in Arizona. And I think that my biggest piece of advice for anybody starting nursing school or wanting to go to nursing school and they're in the process, or if you've been accepted into the program and you're getting ready to start soon, my biggest piece of advice is that you're going to make it and it's all going to be worth it. It's so overwhelming. It's a lot at times. There's times when you are going to feel like you're not going to make it, that you're going to fail, that you don't know the information, or that you're going to be a terrible nurse. And it's not true. You're going to make it. You guys are going to be amazing nurses. Just remember why you're in this, why you're doing this, and you're going to push through. Put that dedication, remember your passion, remember why you're here, and remember why you're doing this, and you will push through. It is not easy, and it was not meant to be easy. Just remember that it's super important to not lose your compassion for people and to remember why you're doing this and that you have a passion for this. I think it's easy to just kind of get stuck in okay, I have this deadline, that deadline, I have to get all this stuff done, and it's overwhelming and you can feel down on yourself, but you're going to make it through. I promise you, and it is not as scary as you think it is. Once you get in it, you're going to love it and just continue to love it even if you hate it. I promise it's going to get better. And it's such a short amount of time for something that you're going to be doing for the rest of your life. So just remember that as you're either doing your prereqs or you're overwhelmed with deadlines because you're about to start the program, or maybe you're in the program and you're like, oh, I don't know about this because it's just so hard. Like, that's okay. It wasn't meant to be easy, but you're going to push through. You're already here, and you're all going to do an amazing job. And I think the second piece of advice I have is just be okay with the unknown, right? I think a lot of us are so used to those, like, I don't know, those prereq classes, like the micro and the bio and all of that, that they have a very well laid out syllabus and very well laid out, information, and here's your deadline, this is what you need to know, and then you study, take the test, dump the information, study, take another test, dump the information, just to make room for the other stuff. And nursing school is nothing like that. You're going to hear a lot of the times people tell you, oh, you can't study like that, you can't do this and that, and it is true, and I think it's hard in the beginning because you really do have to change up the way you study. Nursing is a lot of conceptual thinking. It's a lot of building upon information that you have. So if you're in your prereqs right now, maybe you're in math and that's really hard for you, or maybe you're in your micro or in your anatomy, your patho, your physiology, anything like that, and you think, well, why would I need all this specific information in nursing school? It all builds on it, and it's good to, maybe if you're kind of losing your steam a little bit, to think, well, what is the connection between micro and the human body, and how would I use that as a nurse? Even if you don't know anything about nursing and you're not in nursing school yet, you just know that you want to do it and that's your goal. Think about it, like, why would I need micro in nursing? What could I possibly need it for? If you're in anatomy, that one's kind of a giveaway with the body. But when you're looking at things that are smaller, on the smaller scale, like, I don't know, the sliding filament theory or something with your muscles, think to yourself, well, how could I use this in nursing? And just kind of remember that. Maybe that'll help you, with keep your passion alive for nursing and really push through to get into the program. And if you're in the program, just be patient and be okay with the unknown, because, you're not going to show up to your first day of nursing or your third year of nursing for your shift and know exactly what's going to happen that day. You just need to be confident in the information that you learned. Be assertive with your education. Make sure that you really understand these concepts that you're building on, and then be confident in the things that you know, so that when you get there, you're prepared for something that happens. You're prepared to help and give your patients the best care possible. But I think that's probably the biggest advice I could give you guys. And I hope that this helps somebody out. Maybe a little reminder, like, you're in this for a reason. You guys are going to do great. You're going to succeed. And just try your best. That's all we can all hope for as students. And, try your best, because that's all we can hope for from our nurses and our medical professionals. So yeah, stay tuned. My next video, I'm going to do kind of like a little review of the optional items that I had gotten that kind of have been really helpful for me, and the things that I kind of prep for to go into my first day and my first block for nursing. So if you guys have any questions, go ahead and say them down below in the comments, and I hope this was kind of a little helpful piece for you. So thank you.